Hi, everyone. Thanks for joining us. We're just going to give it about 30 more seconds to let people in, and then we'll get started. Okay, so we're going to get started. Thank you so much for joining. We want to get right to it. We know this is a difficult time for families to join. So I'll do quick introductions and then we'll get started with Dr. Bannach. So I'm Dr. Becca Bell. I'm a pediatric ICU doctor at UVM Children's Hospital in Burlington, and I'm the current president of the Vermont chapter of the American Academy of Pediatrics. And tonight we are so lucky to have Dr. Alex Bannach from North Country Pediatrics in Newport to talk to us today about the COVID-19 vaccine for pediatric patients, specifically for the 5 to 11 age group. So the way this has been working is Dr. Bannach will give us a presentation. She has slides that she'll go through that typically takes about 20 to 30 minutes. You are welcome to go ahead and put your questions into the Q&A, and they're there anonymously, and we will answer them at the end. You're also welcome to wait until after the presentation and then put your questions in, and then we'll spend the second half of the hour answering questions. And just so people know, we try to get to every question we can. Sometimes if lots of people have similar questions, we'll sort of group them and paraphrase. But we've been able to really answer people's pretty personal questions, which has been, I think, really helpful for families. I'm also joined today by Dr. Leah Costello, who's going to moderate the Q&A section at the end, and she's a pediatrician at Timberlane Pediatrics in South Burlington. So with that, I'm going to hand it over to Dr. Alex Bannach. We're so lucky to have her. For all of you that don't know, she was named the Green Mountain Pediatrician of the Year 2021. So take it away, Dr. Bannach.
Thank you, Dr. Bell. I'm so happy that we get to do this tonight, and I'm so thankful to all of you at AAP Vermont for putting this together and for helping us talk to families and helping families to talk to us. Big thanks to Stephanie Winters, who organizes all of this and keeps us running. So I'm gonna, like Dr. Bell said, go through the presentation first. Some of the information that you're going to see will be information that you've heard before, because we've talked a lot about COVID and even COVID vaccines over the last 2 years. There's probably going to be some new information. Some of the slides can look a little overwhelming, but I don't want you to get stressed out about that. I'm going to talk you through them, and they're actually then pretty easy to understand. And I am very excited and happy to do this because I know that so many of us have been waiting for the vaccine for this younger age group for so long and can't wait to get kids protected, and hope that discussing your questions and answering your questions will help you to come to a decision that you feel comfortable with to get your children vaccinated. So the questions that we're hoping to address tonight, among others, are whether your child get vaccinated against COVID, why should your child get vaccinated and what we are protecting them from, and what the possible risks of the vaccine will be. So a lot of concern that we hear from parents is that the vaccine is so new and so different from other vaccines because it is an mRNA vaccine. But it's really important to remember that in essence, this vaccine really works like all the other vaccines that your child has been getting so far to protect them. So in general, when we are exposed to a disease, whether it's through a virus or a bacteria, in this case, the SARS-CoV-2 virus, they attack us, they get inside our body, they multiply there, then our immune system recognizes them and starts fighting them. What we do with vaccines is that we help prime our immune system. and kind of train and coach our immune system to recognize the virus and the bacteria when they come before they really have a big chance to multiply, because we've taught the immune system how to recognize them through the vaccine. And we do that by allowing the body to build antibodies, which then fight the disease. So if you think about a sports analogy, when you have a football team, you don't want that big match against the biggest and best team in the state to be the game where your kids and your team puts on their outfit and their helmets for the first time, doesn't know how to close the straps, where they go out and they've never actually played a game. They've never studied the other team's strategy. They want to do all that before the game so that they can win the game. That's what the vaccines do for our immune system. They help prepare and coach the immune system for the encounter with the disease. As a result of that, the vaccine helps your kids to have a much lesser chance of actually developing COVID when they're exposed to the virus. And in those rare cases, when they do get infected with the virus after the vaccine, they then would not get as sick as they would have gotten without the vaccine. We're very confident that this vaccine is extremely effective, both in protecting the kids from getting COVID in the first place, and even in those few cases when they get COVID after the vaccine, it is very effective at preventing serious cases that lead to hospitalization or even death. Other vaccines about the effectiveness that we get a lot is how long the immunity from the vaccine lasts. And we have some data about that, but we continue to continuously learn more about that. So people have heard that for adults, and soon hopefully also for the older adolescents, we now recommend a booster. And depending on your vaccine, you know, the timing is a little different on how soon after your last dose of the vaccine that will be. But for a lot of people who received Moderna or Pfizer, that's 6 months out. So I, for instance, already received my booster. It's too early for us when it comes to the pediatric vaccine to know what that's going to look like and if they will get a booster, just because we're barely starting to immunize them. And because COVID continues to change and the pandemic worldwide and in this country continues to change. And those are all factors that will influence the recommendations for the booster. We want to make sure that the vaccine is safe when we use it, right? We would not recommend you do something for your children under our watch that we would not consider safe. And the company that makes the vaccines has to prove that the vaccines are safe in order to get them approved for use. So they've done lots of what we call randomized placebo-controlled trials, and those were done independently for each age group before the vaccine was opened up for use. And even after they've started being used, the CDC continues to collect data on them. And really, we're getting so much data from this because we're giving so many of these vaccines, literally hundreds of millions of doses in such a short amount of time, that we're gathering more information than we ever have about a vaccine before, which is very reassuring. Make sure I didn't skip a slide. So it was almost exactly a year ago that we got the emergency use authorization for the age group 16 and up. Previous to that, it was the adults 18 and up who had been able to get the vaccine. And that age group actually received full FDA approval over the summer in August. And in May 2021, the emergency use authorization was extended to include the 12 to 15-year age group. And a general recommendation was made to administer the vaccine to all children in that age group. And as recent as the beginning of this month, we finally received the emergency use authorization for the 5 to 11-year-olds for the pediatric Pfizer vaccine, and a general strong recommendation to get them vaccinated. And we'll talk in more detail about how the pediatric vaccine dosing differs from the older children and the adult vaccine. But we're talking always about the Pfizer-BioNTech vaccine because that is the only one so far approved for use in children. So far, as I've mentioned, over 100 million people have been fully vaccinated alone in the US. So that means they've received at least 2, sometimes 3 doses with the Pfizer vaccine. Out of those, almost 13 million are adolescents. So again, huge numbers that allow us to monitor the vaccine very closely. And as of today, as many as 4 million children already in the 5 to 11 age group have received a dose of the pediatric vaccine that we're going to talk specifically about today. 4 million. That's just a crazy number. It makes me very happy to see that number. So what's different about the pediatric vaccine from the adolescent and the adult vaccine? So it's a smaller dose. With the adult and adolescent vaccine, you get a 30 microgram dose. The children get a 10 microgram dose, so about a third of the dose. But even though the dose is smaller, it produces the same strong immune response as the larger dose does for the older children and adults. The data and the studies that were done for the pediatric age group were also done when the Delta variant was always also very prevalent, which makes it different from some of the earlier data on the vaccine with adults. And despite the Delta variant being present, which is of course a lot more contagious and can make people a lot sicker, the vaccine was over 90% effective in preventing infection. So not just significant illness, but preventing any infection. That's a really impressive number. And no serious side effects were reported. All right, this is one of those slides that can look a little daunting, but it just basically gives a quick overview of what the company had to do in the approval process to get to the point where we can now administer the vaccine to the kids. So there's 3 phases of the vaccine study, starting out with a phase 1, where the goal is to find the right dose for this age group. And they actually tried 3 different doses on the children. They tried the adult dose of 30 micrograms, then a 20 microgram dose, and a 10 microgram dose. And if you remember, the 10 microgram is what we end up using. And they decided on that dose because it worked as well and produced as much protection as the higher dose, but was able to limit side effects. And in general, in medicine, we try to follow the principle of using as much as we need to get the result that we want, but as little as we can to make it as safe as possible. So it follows really that principle. The phase 2 to 3 trials were then the administration of the vaccine in what is called a randomized double-blind study. So there were about 3,000 kids who received the vaccine and 1,500 kids who received a placebo. So they just got an injection with some salt water. And the kids didn't know, the parents didn't know, and the people who administered the vaccine and the scientists who studied the data did not know which kid had gotten the placebo and which kid had gotten the vaccine. And that's to make sure that people aren't biased when they look at the side effects, right? So if people know they get the vaccine, they could think they experience side effects. Same when they get the placebo, they could be looking for something that isn't there. So that's why people aren't being told. So what side effects did they see? There were quite a few people who didn't have any side effects at all. The most common side effect that has been reported in this age group of 5 to 11 are going to sound very familiar to you because they're the same side effects that we talk about with any vaccine that your children get at their well visits. And that is some pain at the injection site, some redness and swelling at the injection site. I think that sounds familiar. And they also, of course, looked at the systemic symptoms, which was reported at a lower rate in this age group, probably because they have a lower dose of the vaccine. The most common among those systemic symptoms are headache and fatigue, but even those are usually mild. And they're very limited, so usually resolve within a few days. The slide shows the side effect analysis in more detail. Again, looks a little overwhelming, but is really easy when we break it down. So the top line shows side effects following the first dose of the vaccine. The second line, side effects following the second dose of the vaccine. And then for each of the listed side effects, so the redness, the swelling, and the pain, it compares the rate in the younger kids with the older adolescents and between the ones who received the vaccine and the ones who received the placebo. You can see the highest bars are for the pain at the injection site, with most of the bar being the green in color for the younger age group, which are the mild symptoms. So up to 75, 74% reported mild, and in some cases moderate pain at the injection site at a somewhat higher rate in the vaccine group than in the placebo group. Yet you can see even in the placebo group, about 30% of kids did report some discomfort. The bars are much smaller for the redness and the swelling. So about 10 to 15% of kids in the vaccine group for this 5 to 11-year-old reported some swelling, and about 15% also some redness at the injection site. Again, remember, we can see this with any of the childhood vaccines we do. Similar slide, a little different. So the top line is the vaccine reaction. The bottom line is now the placebo reaction. And this is all following the second dose. And these are the symptoms that we consider systemic side effects. So those are the things like the fever and the chills and the headaches and the fatigue. You will again see the comparison between the younger age group and the older age group, and then the same color scheme. So if you look at the highest bars, that's the one for the fatigue and headaches. You will see that the younger age group, up to 40% of the kids complained about some fatigue versus 24% in the placebo group, less than in the older age group where that was 65% of the kids. Similarly, that shows in the headache group. So about 28% of the younger kids complained about a mild headache versus 61% of the older age group. And you also see that for the older age group, more of the bar is the turquoise color, whereas in the younger age group, the larger part of the bar is green. So overall, their symptoms were less common, and when they had them, also were milder. You do see that 5 to 10% did complain about some joint pain or some muscle ache, some fevers, but overall, a small rate of those. And again, usually mild and usually short lasting, a day or two. And in general, not severe enough for them to say they had to miss school or activities or daycare, unless of course they had a fever, then they wouldn't want to be in school. Parents are often concerned about the vaccine-associated myocarditis. That's probably one of the things that we get most of the questions about. They did look specifically at that in the trial for the 5 to 11-year-old age group and did not diagnose any cases in that age group. What we do know so far about the myocarditis, that it's most common in the older adolescent boys, and specifically boys following the second dose of the Pfizer vaccine. But even in that age group, where really it's the only age group and the only population where it reaches the numbers that we can detect it really, it is extremely rare. So it's about 1 in 10,000. Or 0.1% is what the slide says. I think the specific number is 0.007%. So very, very, very rare, and usually mild. I often get the question from parents, well, how would I know if my kid develops this? And usually the symptoms are symptoms that would make you call us anyways. So things like chest pain, shortness of breath, excessive fatigue. I don't think your child would have a myocarditis that is significant that you would miss. You would reach out to us. And this is really limited to the first few weeks following the vaccine. So if your kid had the vaccine 3 months ago, you do not need to worry about this anymore. The other important thing to remember is that COVID itself, like other viruses, can cause myocarditis and does cause myocarditis. And they're much more likely to actually get myocarditis when they get infected from COVID than when they get the vaccine. Additionally, the myocarditis they get from the virus itself is more severe, often associated with an ICU admission, versus the vaccine-associated myocarditis is usually mild, self-limited, and much less commonly leads to a hospital admission, and often is treated simply with ibuprofen and other NSAIDs. And taking all that information together, the vaccine is much more likely to actually prevent myocarditis in a child than it is to cause it. And again, most of these numbers come from the older adolescent boys, right? That's where we have this information from at this point. The other question that we get a lot, well, what about late side effects? This vaccine is just being approved for this younger age group. I want to make sure that we don't discover something 2 years down the road that we don't know about right now. So I'm going to wait for my child. Number one, the vaccine itself has been around now for a long time, much longer than any of us wanted to see COVID to be around. But that means we've gathered tons of information, right, from the hundreds of millions of doses given so far of the same vaccine at a higher dose, actually. So that's very reassuring. The other thing that's really important to know is that with any of the vaccines that we've been doing for more than 50 years, there's never been a new side effect that's been documented that's developed after more than 2 months out from the vaccine. And the COVID Pfizer vaccine, of course, has been around for a lot longer than that. There's also, on a scientific basis, just simply no biologic mechanism which would allow the vaccine to cause any long-term changes, since that mRNA, which is the carrier in the vaccine, gets destroyed by our own bodies within just a couple of days. So it doesn't hang around. It also does not, that's the other concern that I often hear, does it change our DNA? Does it change our genetic material? And it actually does not. It does not and cannot enter the nucleus of your cell, which is where your DNA lives. So then what are the risks of the COVID infection in this 5 and 11-year-old age group, right? Why should I get my child vaccinated? So data is very real. So far, well, that's actually data from last month. We've seen nationwide more than 8,300 hospitalizations of children 5 to 11 for COVID. And a third of them end up having to go to the ICU. So that means they're really, really, really sick. They're sick enough, for instance, that we would not be able to care for them at North Country Hospital. We would need to transfer them down to the ICU at UVM, where they would probably have quite a stay and would be quite sick, so sick that it would be scary. And that's what we're trying to avoid here and to protect our children from. There also, unfortunately, have been COVID-related deaths in this age group, and we don't really think of children 5 to 11 dying or want to think about them dying from something that we can prevent with a vaccine. But we're up to almost 100 cases of COVID-19 deaths just in this age group alone. And that is 94 too many if we can prevent them. So now we're going to look at data that are Vermont specific. These are from the beginning of the year. And we're going to look at the left side first, the gray and orange bars, where you see, last winter, we all thought it was really rough and COVID was everywhere. We had a second spike in the spring, then things got better in the summer. People started getting immunized that first half, also when we had a mask mandate. In the summer, people were able to get outside. More and more people got immunized and protected. It was easier to meet socially in a safe way, being outside. Well, then the fall came, Delta came, our cases really spiked, and we continued to see a significant rise in numbers, literally every week. I do want to make sure that those shorter bars at the end are probably not representative, because there's been a lot less testing in the Thanksgiving week because people were sitting at home eating yummy food. So we expect that we will see quite a spike in the coming weeks as a result of that. The graph on the right with the three colors, the green, purple, and blue, shows basically the same data, but this is only children data. So what you can see in that is that last winter, the green bar had covered the largest area of the bars. That's the 12 to 18 year age group. That's when we saw the highest case number rates in that age group. Then we got that summer dip. We got the vaccine for the older adolescents. And now what we've seen as a result of the vaccine coverage is that their bar has actually gotten smaller, and it's shifted to the younger age group. So the 5 to 11-year-olds are now the ones with the highest case rate. And that's where we're seeing the highest case numbers. So that's really putting an urgency to getting those children protected with a vaccine. This is basically the same data, just showing it as a line instead of the bars. Again, the 6 to 11 age group with a purple with the highest line. And don't believe that dip at the end. That's not gonna hold true. We're gonna see that increase again as we catch up with Thanksgiving data. Overall in the country, Vermont has done relatively well with our case rate at about 9,000 children per 100,000. You see other states who are struggling a lot more, but of course, we don't want to really have any if we can prevent it. So our goal is at the very bottom. We don't want to rank high in this. We know that Vermont has done really well with vaccine coverage. So this is a chart that looks at the vaccine coverage rate for the older age group, the 12 to 17-year-olds. And you can see that Vermont is in the dark blue, which means that we have a really high vaccination rate. However, there's a lot of regional variation. And unfortunately, our part of the kingdom has not so far done very well with our vaccine coverage in general, including, unfortunately, the adolescents. And so we're really going to try and catch up here and also get a head start on the pediatric population. What other symptoms can COVID cause? Why are we so worried about it? And how sick can the kids get? So from the adult population, you might have heard about the COVID pneumonia. That's the part where people really get into trouble with their breathing. That can lead to people needing a ventilator and being admitted to the ICU. And that unfortunately can affect children just as much as it can adults. That interferes with your ability to oxygenate your blood. And of course, we need oxygen to live, right? And in some cases, it needs as little as giving you extra oxygen, but it can be as bad as needing breathing assistance with a ventilator machine, and that will be in an ICU. We have seen severe cases in the adolescent age group, and those are 10 times more likely in the unvaccinated adolescents. So we know that the vaccine works, and we know that the vaccine will work for the younger children as well. And we're seeing more of this, of course, with the Delta variant that is just so much more contagious. Some of you might have heard of a complication of COVID called MIS-C, or multisystem inflammatory syndrome, which is something that occurs at the time of or shortly following a COVID infection, and as a result of the huge inflammatory reaction that COVID causes. And as a result of that, can affect many of the organ systems. In fact, in order to get the diagnosis, you at least have to have 2 body organs involved. So that could be the heart with a myocarditis that we've talked about earlier, which is a heart muscle inflammation. And in those cases, that can unfortunately be very severe. That could be your lungs. It could be your skin. It could be your kidneys. And those children usually are so severely ill that they need to be admitted to the hospital. And we can find signs of that level of inflammation in the blood work that we do. So far, there have been over 5,500 cases of MIS-C reported in the US, including 48 deaths. And unfortunately, and this was surprising to me as well, the MIS-C is most common in the age group of 5 to 11. You know, we don't want to see this. We want to protect our children from this with the vaccine. So the CDC, when looking at the vaccine data and how beneficial the vaccine would be, did some calculations and ran some numbers. And if we gave 1 million COVID-19 vaccine to children 5 to 11, we would prevent about 57,000 cases of COVID, including between 190 and 226 hospital admissions, 130 cases of the MIS-C that we just talked about, and 60 to 70 ICU admissions. So those are real numbers, right? If we can help our children not get there, that would be great. So how do we weigh the risks and the benefits of the vaccine? We've talked a lot about the benefits, preventing the COVID disease with all its complications, the hospital admissions and the deaths. And then we're going to look at the risks, right? Specifically, the side effects that we talked about, which are mild and less common in this age group, as well as the reports of myocarditis and pericarditis. And we talked about the fact that the vaccine-associated myocarditis is shorter, milder, and much less common for the vaccine than it is for the actual COVID illness, all supporting the benefit of the vaccine. And then there are all these other benefits that we can not really expressed very well in numbers, but that will affect all your lives and our lives every day. So the benefit that protecting this age group, which has the largest bar in the rate of COVID right now, from catching COVID and therefore spreading COVID to other children and to other family members and community members, and therefore finally slowing down that pandemic. The fact that when your children are immunized and are protected, they will be able to stay in school, even when they had an exposure in school. They will be able to be with their friends. They will be able to learn, which is so much harder through remote schooling than it is in person. It also means that you as parents don't have to miss out on work because your kid is home again. So it really just helps everybody go back to life as it really should be. And then we have to worry less about the MIC and the long COVID, which we can see post the infection. And that's exactly the question that was put to the voting committee at the FDA. Based on the scientific evidence, do the benefits of the vaccine with a 2-dose regimen outweigh its risks for use in children 5 to 11 years of age? And we all know the answer. The committee voted that yes, the benefits do outweigh the risks, and therefore the emergency use authorization was granted, and we're now able to administer the vaccine. We'll talk a little bit more about the dosing of the vaccine. Parents often know that in pediatrics, we frequently dose medications based on weight. So your Tylenol, your ibuprofen, a lot of the antibiotics. And you might wonder why we don't do that with the vaccines. But of course, vaccines work very differently from medications because they interact with our immune system. And our immune system's function depends on our age and the immune system maturity rather than our weight. And younger children's immune system in general responds very well, and so might need a lower dose of vaccine. Some of you remember that from the flu vaccine. Some of the flu vaccine products actually give a smaller dose at younger ages. And we're also continuing to look at getting a vaccine for children under age 5, and clinical trials are now underway for children as young as 6 months of age, where they're testing even smaller doses to try again and minimize side effects while still getting the same amount of protection. This is flu season. We're doing a ton of flu vaccines, and children are getting vaccines at their well childs at regular intervals. So parents often want to know if it's okay to get the vaccine for COVID at the same time as other vaccines, or if there needs to be a certain time interval. And we're happy to report that you can get the COVID vaccine along with your other vaccines. There's no certain time interval that needs to be kept. That was initially recommended when the vaccine came out for the adults, but was soon revised, and people are now getting the COVID vaccine along with other vaccines, and it works very well. It does take about 2 weeks after the second dose for your body to build up immunity to the virus. And so you want to build that into your timeline. You don't need to worry about money because the vaccines are free, even without health insurance. And it's very easy to register for the vaccine through the health department website, where you can register for school-based clinics, for community-based vaccination clinics, even for some of the pharmacies who have the vaccine. I do want to say that you need to register for the pharmacy-based ones. They do not usually accommodate walk-ins. We will have another vaccine clinic this week, Saturday, at the hospital that you can register for that will accommodate walk-ins for the pediatric age group. And we're hoping to finally have the vaccine in the office next week. If you're a family that feels more comfortable getting your child vaccinated in your doctor's office, please call your doctor's office, see if they offer the vaccine. If they do not have it yet, see if they will put you on a wait list so that you can be called when they do have it. And you can also register for an appointment by phone. That phone number is also available on the website, and your doctor's office should also be able to provide that to you if you don't have access to a computer. There's lots and lots and lots of really good information on the health department website, on healthychildren.org, which is the parent website of the American Academy of Pediatrics, and of course on the CDC website that I really want to encourage all of you to look at if you have any questions. And this is just a screenshot of one of the sites at the health department, and you can see there's lots of more information to be had there. These are pictures that I love of kids who just got their vaccine and are super stinking proud and feel very strong to be protected. And I want to open up for questions and answers and encourage all of you to also always call your doctor and your kid's doctor to get your questions answered, or ask them when you have a visit if that opportunity arises. Thank you.
Thank you. Thank you, Dr. Bannach. That was great, and a great overview of the COVID vaccine and the risks and benefits, and why we certainly feel like the benefits do outweigh the risk for this population. I have some great questions that I wanted to go over from our attendees, and that hopefully will help clarify even more for families as they make this decision for their own kids. One question we have is about the rate of transmission after the vaccine. If somebody should have a breakthrough case, are we seeing a decreased rate of transmission even in the time of the Delta variant for folks who are vaccinated?
Yeah, that's a great question. And, you know, people, I think, are always disappointed when they hear about breakthrough transmission. And we all wish we had vaccines that were 100% effective, really, for any vaccine preventable disease. We don't, but the biggest goal is to slow transmission and to help and prevent serious disease and death, and that vaccine does that very well. You can transmit the virus when you have the illness, even after you're vaccinated. I don't, off the top of my head, have any specific data to speak about, you know, what exactly that rate is compared to the rate in unvaccinated people, because your risk of getting ill is lower and your symptoms are milder. I would expect that the transmission rate is lower, but I don't know if Dr. Bell has any more specific data.
Well, I think that I usually start with thinking about the vaccine decreases infection, right? So when you presented the vaccine efficacy rates that we saw in the time after the trial participants received the vaccine, it was 90.7% effective, right? So I think that is actually the first thing to think about, is that if you don't get infected, you can't transmit the virus. And I think that's a really big starting point, is that you've got now so many people that aren't even going to get infected. But then those that do, you know, I think trying to sort out exactly what the transmission rate is from those breakthrough infections is challenging. There's so many variables. We do have evidence that the time of infectivity is shorter in someone who's vaccinated, which makes sense, right? So I loved your analogy of the football team. Like, you want to be training and getting prepared before you have your big game. So if you have a prepared team ready, you're exposed to the virus gets in your nose, starts to replicate, and your body recognizes it and is able to deal with it. That infectious period is a little bit shorter, and so presumably your transmitting during a shorter period of time, but really nailing down those numbers, I think, is challenging with all the variables.
Mhm.
I agree. And I can give the same information to my families that ask similar questions in my office. We had another great question that about from a family who has one of their children has autism and actually has never had a vaccine. And this family is wondering if there's been any particular studies done on the side effects in the population of autistic children, and is it possible that the vaccine would have a different effect on a child who is on the spectrum? What do you think about that, Dr. Bannach?
Yeah. So first of all, I think that it's wonderful that they're considering getting their child vaccinated, especially if the child hasn't had any other vaccines so far. And I think that's a really great step. And I think it's wonderful that they're asking the question to get those questions answered to make sure that they feel comfortable. We don't have any specific data on children with autism, but there's really no reason for us to think that they react any differently from children that don't have autism. The function of the vaccine would be exactly the same. The protection they would get from the vaccine would be exactly the same in terms of, the effectiveness. But a lot of children with autism have really struggled being compliant with wearing a mask, being able to follow, good hygiene precautions due to the nature of autism. And so having a way to protect them as they're struggling with those is so much more important. And so if anything, they would benefit even more from the vaccine, but no reason to suspect that they would experience any side effects that are different or more severe than other children that the vaccine was tested in.
I agree with that. And I, when looking through the data presented by Pfizer, they did certainly point out that they included a representative population in terms of racial diversity, and then also medical diversity as well. But they really commented more on symptom or conditions such as asthma. I don't remember specifically things done on children with autism or comments on that. I don't know if you saw anything, Dr. Bell, when you read through the data submitted by Pfizer.
I did not, beyond what you just mentioned. And I was hoping, Dr. Bannach, and then maybe Dr. Cassell too, you could comment just generally about, I think this is such a good question. There's so much vaccine misinformation historically that surrounds autism spectrum disorder. So how do we talk to families? I take care of many families in the ICU whose children have autism spectrum disorder and have been really hesitant about getting their children vaccinated. So, we're talking about the COVID vaccine today, but I'm sure you've had these conversations about all vaccines. I think woven into that, there's the misinformation, but then there's also it's more challenging and sometimes frightening for these children to get vaccinated. So, Dr. Bannach, how do you talk to families like COVID vaccine or even any other vaccine in a child who may be sensitive, whose parents may be hesitant just because of all the historical misinformation?
Yeah. So I think there's really, right, there's almost like two different topics here. One is how do you make kids with autism or really any other special need as comfortable as possible for vaccines. And that's, for instance, a case where these parents or the kids might be a lot more comfortable in the doctor's office than they are in a big vaccine clinic or in a drugstore, because the kids know the building, the kids know us, the kids know the nurse that's going to come in to give the shot. The parents know us and feel comfortable with us. So that's probably a family that I would encourage to talk to their doctor to see when they can get the kid vaccinated in their doctor's office. most parents of autistic children and children with other needs know their kids very well and know how to get them comfortable. So we always encourage, if they have specific comfort objects, whether that's their favorite blankie, their favorite stuffed animal. I've seen a lot of kids, even just kids in the regular vaccine clinic, not kids with autism, bring those silicone poppers. Those seem to be very popular to distract. Our nurses are excellent in distracting kids. We're very good at blowing bubbles. And we're very good at accommodating the kids. You know, some kids prefer not to be touched. Some kids prefer to be hugged by their parents. And so we really work with the families, and the families work with us. And we try and really take that into account. And I think that can make it a lot less challenging for the kids, because you want to bring them back for the second dose, right? So you don't want them to have too bad an experience so that they don't want to come back next time. With regards to misinformation about vaccines causing autism, in quotes, we usually start these conversations early in the kids with autism, shortly following the diagnosis. Often, you know, even in kids who don't have autism, it's still one of the concerns that families bring up. And of course, that all originally started with a falsified and ever since discredited report about the association between the MMR vaccine, the measles, mumps, rubella vaccine, and autism, which we know was completely made up, and the physician who actually publicized that lost his license to practice, and it's long been proven wrong. And there has been very detailed looks at vaccines and autism, and even though we are seeing increasing rates of autism, there is absolutely no association with vaccines, not just the measles, mumps, rubella, but really any vaccine. I really usually am able to have good conversations with parents about that.
I agree with you, Dr. Bannach. It's just so important to start the conversation early, have a trusting provider who you see and can talk to and address all of your concerns. And it's really overwhelming to have a child with any diagnosis and to do right for your child, and make those hard decisions. But I can, really feel like when I speak with my families and patients about this, that I can feel really confident that I would never recommend anything for one of my patients that I don't do for my own kids. And I would never recommend anything for a patient that I didn't think would be safe and effective. But I think, I don't think this person's asking about vaccines causing autism. Just do kids with autism have a different response to them? Do they put them at different risk, put siblings at different risk? I think that's but I think that's, part of the conversation around this. I do want to get to a few other questions today, that just so we can make sure that we address all of them. I think a real common question, and one we're seeing here, is about the difference between the dosing for younger kids and older kids. And if a child is about to turn 12, should a parent wait to get the bigger dose until their child turns 12 in later December or January or February? What would you recommend in that situation?
Yeah, we actually had a parent call the office this week and ask that question, the very same question. Because, sometimes people feel, well, the bigger vaccine dose is going to work better, right? Because it's a quote unquote stronger vaccine. But we talked about in the slideshow a little bit that that's not really quite how it works. Our immune system just matures with age, and they were able to prove that, by age group, both vaccines work really well. And it's not like your immune system just switches overnight. And with the numbers that we're seeing in our community right now, and the rate of infections that we're seeing, and the number of school closures, your child cannot get that vaccine soon enough. So there's no reason for you to wait to get him the vaccine just until after their birthday. And what we would do in a case like this, if the child starts out when they're 11 and they get the lower vaccine dose, but then they turn 12 before they get their second dose, and so are at 12 by the time they're due for their second dose, they actually then would get the second dose according to their age. So they would get the 12-year vaccine for their second dose, even though they had the 11-year vaccine for their first dose. And we know that that's safe, that's recommended, and that might be some reassurance to those parents, but please don't wait. COVID is out there and there's so much of it, and please get your child protected as soon as possible.
And that's true on the flip side too, like a very small 5-year-old, we don't recommend waiting at all. There's no reason to wait. The vaccine is not a medicine. It is a not dosed like we do Tylenol and ibuprofen and antibiotics. It is a vaccine. It works a different way, and it is based on their immune response and how robust their immune system is. So even if you have a tiny premature 5-year-old, or someone who's born prematurely, you still get the 10 microgram dose. They don't need a smaller dose that might come out later with, hopefully, as we get more information about vaccinating younger kids. Can you, Dr. Bannach, talk about what you recommend if one of your patients has had COVID in the past? What's the timing on getting a vaccine, and should they get vaccinated?
Yes, also a question that we unfortunately have a lot these days, because just we're seeing so many kids with COVID, right? And so we have this conversation every day. I had this conversation at least twice today. There's still a lot of people out there who have heard that you should wait up to 90 days between having COVID and then getting your vaccine, which very early into the vaccine and the pandemic was indeed something that was recommended. But at this point, we have very clear recommendations for completing your isolation period, making sure you're out of that infectious period, and then you should have recovered from your symptoms, which thankfully in a lot of kids are very mild symptoms. But as soon as your isolation period is completed and your symptoms are resolved, you can and should get the vaccine. So there's no need to wait a certain time period between having recovered from COVID and getting your vaccine. It's really safe to do. It helps protect your kids even better and even longer than just having had the illness. And we know that it will allow them to go back to school and back to play and keep them safe. So get it as soon as your isolation period is over and your kids have recovered from their illness.
Thank you for that answer. We have another great question, which is regarding myocarditis in kids. Is there any circumstances such as a heart murmur or a congenital heart disease that might put a kid at higher risk for getting myocarditis after the vaccine? And how should we counsel this family that's asking this question?
Yeah, a very good question, right? Especially families who've had COVID know that, especially in the older kids, we need to clear them for return to sports. And we ask a lot of questions about their heart and how healthy their heart is and the family history of heart disease and so forth. So really good question to ask. We actually think about it the other way around. So we consider kids who have a heart condition as well as lung conditions and other medical problems at higher risk from COVID. So those are the kids we really want to protect with the vaccine, but they're not at higher risk from getting myocarditis from the vaccine. They're at higher risk from COVID, the disease, but not from the vaccine itself. So we feel that it's even more important for those kids to get the vaccine and to be protected so that they don't develop the myocarditis when they get COVID or when they develop MIS-C. And as we've seen in the slideshow, the risk for myocarditis from COVID is really much more significant, right? And that would be the real risk for those kids. So even more important if your child has a heart condition, to get them protected and to get them vaccinated to help protect their heart from that.
I agree, and that's exactly the advice from the pediatric cardiology associations as well. So one last question I think is kind of linked into two questions, but if we're seeing breakthrough infections, why are we recommending vaccines? And the same thing is, like, if we're saying these vaccines are so effective, why are we suddenly saying everybody should get a booster? Every adult over the age of 18. Right. So why are we recommending vaccines if we're still seeing this persist?
Yeah. So two parts to the question, right? Both really interesting questions. So I think it's not a surprise to anybody that we're continuing to learn almost every day new things about COVID as the pandemic develops and gaining knowledge every day. So circumstances change, numbers change. We do know that the vaccine works very well. We know in adults that the immunity can lessen after periods of time, hence the recommendation for a booster for adults if they've had the mRNA vaccine more than 6 months ago or the J&J vaccine more than 2 months ago. In children, especially the 5 to 11-year age group, which we're talking about tonight, it is really too early to say if there will be a recommendation for a booster for them or not. But data will continue to come in. We will continue to learn more about how the virus behaves and how well the protection lasts in children. And then the recommendations will be adjusted. And if the immunity wanes for them, then there likely will be a booster recommendation. But what exactly that will look like and if and when that will happen, only time will tell. And that's good, right? We don't want to do things that aren't necessary, and we want to be adjustable to the situation, to the needs of the pandemic. So stay tuned for more, as always with COVID. And the second part about why should we immunize in the first place, if we can still see infections, number one, almost 91% are protected from the disease. That's just a stunning number. I mean, that's 91 out of 100 kids that don't get COVID, that cannot spread COVID because they don't get it. So they don't get grandma and grandpa sick and the other kids in their school and the other kids on their sports team. So that's 91 really, really strong arguments. And in those cases where we do see breakthrough infections, again, they're rare, they're possible, but they're rare. And then they're just so much milder. And if we can if we can do anything to help our kids stay healthy, especially when it comes to a virus like COVID, then we should do it.
I completely agree. And I think that's a wonderful way to close tonight. That we should do this if we have it available and we feel like it is safe and effective and we can protect against a really serious disease and hopefully keep our children in school, which is so important, and our families and community healthy. So Dr. Bell or Dr. Bannach, any closing words tonight? I really thank our participants, and I thank our attendees as well for spending their time listening to us and really thinking critically about this vaccine and making that important choice for your child and your family.
I agree. Thank you so much for giving me the time to do this. And again, if you have any questions left after tonight, please call you doctor. We're all so happy to talk to you about this and help you keep your kids healthy. Thank you.
Good night, everyone. Thanks for joining.
Good night.
Thank you.